Did you know that a doctor is more likely to amputate your limb if you are Black? I provide patient advocacy tips and how to navigate the healthcare system in order to stay safe. And one thing that isn't talked about enough in general is racial disparity within healthcare. I did a research paper in college about racial disparity for Black pregnant women. And Black infants' mortality is 2 times higher than white. You are 3 times more likely as a Black woman to pass from pregnancy-related reasons than a white woman. And preterm births are higher. Maternal mortality rates have overall, the rates have dropped, but the racial gap of the mortality has risen. This extends beyond just women and childbirth. You are less likely to be referred to a pain specialist, and you are more likely to be screened for substance abuse if you are Black. According to the American Medical Association Journal of Ethics, Black people are more likely to have limbs amputated. And that is because white people have a higher chance of being provided interventions to save the limb than Black people. Racial biases influence quality of care. I've done a lot of videos on how women in general are not heard within the healthcare system, and that men are much more likely to receive, to be listened to receive care. Now imagine you are a Black woman. You're already at a disadvantage as a woman. You are at an even greater disadvantage as a Black woman. This is unacceptable and it needs to be talked about. How do you educate for yourself and about your health? The first thing is ensure that you are educated about your health. Have an understanding of your health conditions. Secondly, ask questions. Are there alternative treatments available? Why is the doctor recommending this? Are there other things to consider? Find culturally competent providers. Have a copy of your records, your test results, and know your rights. Know your rights to a second opinion. And as healthcare clinicians, there are racial biases, there are racial disparities, and we probably have them. So everyone needs to take a good look at themselves and ensure that we are treating and advocating for patients equally.
Imagine dedicating your life to nursing, showing up every day to care for patients, and instead of being valued, being humiliated and punished because of the color of your skin. So that was the reality for nurse Donquinique Yvonne Joppi at the Medical Center of Aurora in Colorado. When she applied for advanced cardiac training, a charge nurse told her she lacked the intelligence and organizational skills, then mocked her by saying she could clean his house and clip his dog's toenails. She was falsely accused of stealing a white patient's credit card to buy a stethoscope, and instead of investigating, the hospital restricted her from break rooms and locker rooms, treating her like a criminal. While her white peers managed 2 patients in the ICU, she was overloaded with 3, and when she spoke up about the unfair workload, she was retaliated against with a performance plan. Even her tone and body language were policed in ways her white co-workers never faced. But the worst came when she stayed overtime to help a colleague honor a dying patient's end-of-life wishes. Acting under a physician's verbal order relayed by staff, she helped remove a ventilator. The hospital didn't back her. They fired her, claimed she acted without authorization, and referred her for prosecution. She was dragged through the courts on manslaughter and neglect charges that were later dropped in the interest of justice. So this month, a federal jury finally saw the truth. They awarded her $20 million, finding that HCA Health One discriminated against her because of her race and retaliated when she tried to defend herself. This verdict is bigger than one nurse's story. It tells every hospital executive racism, retaliation, and scapegoating have consequences. And it tells every nurse, every tech, and every aide, you are not powerless. Her courage shows that even against a healthcare giant, justice can be won. Her fight is now a landmark, a reminder that dignity, respect, and equity are not optional in healthcare. They are a right.
So I just saw a video of a Black woman who walked into a traditional Chinese medicine hospital in Guangzhou. She wasn't in crisis. She wasn't bleeding out. She just wanted some herbs. She told the doctor her symptoms. And instead of sending her home with a little paper bag, they admit her, like, right there. No ER wait, no insurance interrogation, no proving that she's sick enough to deserve care. They give her a spotless bed, a balcony for fresh air, daily tests, both herbal and Western medicine. And they do it all without hesitation. Because the goal is simple, treat the problem and the person before it becomes an emergency. Meanwhile, back here in America, this same exact Black woman could walk into a hospital and be told to go home the same day. Because here, healthcare wasn't built to save everybody. For most of the 20th century, hospitals were legally segregated under Jim Crow. Black hospitals starved of funding, staff, and equipment. White hospitals got the latest machines, the best specialists, and the lion's share of federal money. Even after the Civil Rights Act, some Southern hospitals shut down completely instead of just integrating. Others found loopholes to keep us out. Then they tied healthcare to employment, knowing damn well that Black people were locked out of industries and union jobs with real benefits. That wasn't oversight, that was engineering. And it worked. Today, Black women are 3 times more likely to die during childbirth. Black patients are less likely to be given pain medication, even with the same symptoms as white patients. Whole Black neighborhoods are medicine deserts with no urgent care and no specialists. This isn't a system that needs improvement. It's a system that's functioning exactly how it was designed, to ration care based on who they think is worth saving. So when I watch this Black woman get admitted in China without a fight, I'm not thinking, wow, they're advanced. I'm thinking, what the hell is wrong with this country? Because in America, she'd be waiting for hours, arguing with insurance and praying the doctor actually listens. And if she died while waiting, we'd call it tragic instead of calling it what it was. The point.
I want to talk about how I went to the emergency room today for help, and I ended up being labeled as violent for advocating for my health. This is what medical racism looks like in real time. I'm 3 weeks post-op from a tonsillectomy. I went to the ER because I found a lump in my throat this morning and I thought it might be an abscess. And if you know anything about those, they can be life-threatening. The nurse practitioner came into the room and immediately started minimizing my symptoms and brushing me off. And then proceeded to tell me that it's probably a virus. And sometimes people get viruses and they get patches in their throat that can even look like herpes. Like, excuse me? I insisted that I thought it was an abscess and I wanted them to evaluate it. And that woman looked me dead in my face and told me there's no way she could determine if it's an abscess or not, as if we weren't in the emergency room where she can do a CT scan. Instead, she put in an order for a strep test and then told me to keep taking my allergy medicines. So when the nurse came in the room to give me the strep test, I let him know that I was just going to go to another hospital because I did not feel like I was being properly evaluated. And I said it just like that, no attitude, no yelling at him or anything. And he was like, well, hold on, let me go talk to the nurse practitioner before you go. I'm like, okay. So I actually sat there and I waited for him to come back, but he didn't. I could hear them chit-chatting in the hallway. So anyway, I walk out to the nurse's station and I say, will you please document in my chart that this provider refused to do any imaging? And then the nurse started asking me questions. I'm like, yeah, I got my tonsils out 3 weeks ago and there's a patch in the back of my throat all of a sudden. And so she wrote it in my chart. I watched her put it in my chart. Like I could see it on my phone. And she goes over to like print it out for me. And that's when she comes back with the nurse practitioner. And the nurse practitioner has this paper and she insists that I need to sign it before I go. I take it from her and I read it. And it's basically saying that I waive them from all liability if anything happens to me after I walk out of the hospital. I was like, I'm not signing this. And I took the paper from her and I ripped it in half and I let it fall to the floor. Now, mind you, all of this was super calm. Like, my tone of voice that I'm using to speak to you right now is how I was talking to them. I'm like, I'm not signing this. Because why would I agree to waive them of all liability when they are clearly not evaluating me properly? And after that, I turned to one of the other nurses and I said, can you show me the way out? And she did. And me and that nice black nurse walked down the hallway together. She was like, girl, you ripped up that paper. I was like, I did, because of what was on it and what she was trying to get me to sign. Still super calm. No yelling at anybody. No cussing anybody out. And honestly, I would have felt justified if I had yelled at them or cussed them out. But I did not do anything. By the time I made it to my car, that provider had put in one of my main diagnoses from today as violent behavior. Not possible abscess, not patient is concerned after surgery. She put that I had a sore throat and violent behavior. All because I am a black woman who stood her ground. This is the angry black woman stereotype in action. This is racism in healthcare. This is how black women die. Not because we don't ask for help, but when we do, when we start advocating for ourselves, they look for ways to punish us for it. I chose to go to another hospital. I refused to sign a paper that said I waive that hospital of liability for anything that happens to me. And I was labeled as violent because I ripped up the sheet of paper that they gave me. And I want people to know that this isn't just my story, it's a pattern. The provider's name is Amanda Theriot, and she works at Ochsner Baptist Hospital in New Orleans.
So real quick, I'm sitting in the garage at work before I clock in because I got to clock in just a few minutes, okay? I don't think we talk enough about what it's like to be a black girl in nursing, especially if you're a black girl in critical care spaces, okay? Like me, I've been a nurse for 5 years. I came in at the beginning of the pandemic. I landed my job 6 months before I graduated, which was... pandemic wasn't even a thing, okay? Pandemic hit as I was leaving nursing school. The very first job I had, I was a neuro ICU nurse with cross-training to surgical and transplant ICU. The manager refused flat out to hire. She did not want to hire me for nothing. She kept trying to talk me out of it. It's so fast-paced, it's this, it's that. I don't think you would be able to handle it. All these other things, just to find out that another student that I was with when we was in nursing school got hired on at the exact same unit. And I only knew that because when we went to orientation, she was sitting there right next to me and said, no, she never said that to me. The same way when I was wanting to work P, which I'm in Peds now, but the old hospital I worked at, I wanted to work Peds. They kept saying, we don't hire new grads, we don't hire new grads, we don't hire new grads. And 3 of my white counterparts walked straight into NICU and pediatric ICU positions, okay? This is what I'm talking about. This is the gatekeep that comes with trying to be a black girl in a space that is not meant for you, that is not that you don't fit the aesthetic of the unit, okay? And again, I'm not saying if this is a current situation, because it's not, but in my experience, this is the things that have been happening. And then when you get into these spaces, it's a mean girl environment. They want to try to drive you out. They want to try to make it hard for you. They want to try to limit your education and the things that you know, so they can make it seem like you're not competent or you're not up to par. Now, prime example is, as I was on orientation as a brand new baby nurse, they put me with a preceptor who basically she literally verbatim told me, unless you ask me a question, there's nothing that I could tell you. I don't tell you anything. You must ask me. As I'm handling drips and CRT machines. So I basically followed her around for the first few days, and I'm like, well, I don't know what I should be asking. Why don't you just tell me what I need to be asking, or show me what I need to know? And so they finally put me with another preceptor, right? Anyway, they put me with another preceptor, and the experience was just a little bit better. Not too much better, but it was a little bit better. Now, what happens is also, what I noticed is that I would get the shittiest of the shittiest assignments. They would throw me to the wolves, but they don't know I got that dog in me. I'm about that bark. I got the bark and the bite to match. I'm a swim before I sink, okay? I'm gonna make sure that I got all the stuff that I need. And if I don't, baby, I know how to look up and ask for help. I know how to figure this out. So I also want to sit there and say that just be mindful of the type of nurse that you're going to be and the type of nurse that you are, especially if you're wanting to get into these spaces like the ED, the ER, whatever you want to call it, ICUs, things like that, because a lot of times it is not meant for you, and they will try to do their best to drive you out. They will do their best to say that you're not being cohesive to the unit, you're not communicating enough, you're not a part of the team, it seems hostile. They watch every single thing you do. You cannot do what they do. If a million people are walking around with AirPods in their ears, you cannot. If a million people are walking around talking and laughing about their day, cussing and stuff, you cannot, because that is the goal, to get you out. Not every place. I'm just saying, as a generalization, be careful what you say and what you do inside, especially when you know that you know what you know. A lot of times your knowledge will be questioned. People can go behind you about your patients. A lot of times anonymous reports get sent. Just protect yourself and protect your license, okay? And that's all I want to say for all the new nurses that are coming in. If you're a black nurse and you're coming in and you're thinking this is what you want to do, first of all, don't take no for an answer. Second of all, protect your license. Third of all, know that you have all the tools that you need with you, and do some studying outside of work. Look up your hospital's policies and procedures. That way they can't tell you that something is not right when you know you followed it to the T. Okay? Love you. Bye.